Hello everyone, I am Dr. Niharika Virkar. I am an orthopedic hand surgeon at Pinnacle Hospital in Thane. Today, two anesthetists, that is Dr. Yoginee Yadwadkar and Dr. Roopali Patil, will be joining me to answer some of the most common questions related to anesthesia when performing any surgery. Hello Dr. Yoginee.
Hi, hello.
So the first question that I want to ask you is, what are the common types of anesthesia that you all usually use?
Basically, there are 4 types of anesthesia. First is general anesthesia. In that, we anesthetize the patient by injecting anesthetic agent through IV line or by inhalational technique. And in that, patient is totally unconscious, pain-free. Then second type is regional anesthesia. In that, we anesthetize particular region of the body. And in that, we give anesthetic agent near the nerves. Example are spinal anesthesia, epidural anesthesia and peripheral nerve blocks. In that, patient may be awake or sedated depending on the patient or anesthetist. Third technique is local anesthesia. In that type of anesthesia, we anesthetize small area of the patient either by injecting local anesthetist around that area or by giving topical anesthesia. And last is monitored anesthesia care. In that, patient may be drowsy or lightly sedated depending on the need of the surgery.
Which kind of anesthesia do you all generally prefer for upper limb or hand surgeries?
We generally prefer brachial plexus anesthesia through interscalene technique or supraclavicular or axillary approach, depending on which part of hand we are operating.
Okay, so that is basically the regional anesthesia or a local anesthesia?
No, it is regional anesthesia. Brachial plexus block is regional anesthesia, but there are 3 different techniques: interscalene, supraclavicular and axillary.
Okay, ma'am. Ma'am, can you please tell us about any contraindications that are there for regional anesthesia?
Basically, 2 kinds of contraindication: absolute contraindication and relative contraindication. First is absolute contraindication. Patient's refusal is absolute contraindication for regional anesthesia. Second, allergy to local anesthetic agent is second absolute contraindication. Then relative contraindication. If there is local site infection, this is relative contraindication. If due to any reason patient is uncooperative for giving regional anesthesia, then we cannot give them regional anesthesia. Third thing is coagulopathies. And fourth is, if a patient is having pre-existing neurological deficit, we cannot give them regional anesthesia.
Tell us a little bit about the benefits of regional anesthesia and why this technique is so popular.
Yes, it is very beneficial because it avoids all complication of general anesthesia. Like post-operative nausea, vomiting, we can avoid. Pulmonary complications which can occur due to general anesthesia, we can minimize that. Then analgesia is of superior quality in regional anesthesia. We can mobilize patient early, so risk of DVT also get minimized. Patient can eat earlier, so recovery becomes faster.
Dr. Roopali Patil, who is also a senior anesthetist at Pinnacle Hospital, is now joined us. She will be addressing some of the other common queries that patients normally have. So ma'am, a lot of patients are often concerned about what exactly is the difference between regional and local anesthesia.
See, ideally, the drugs used in regional and local anesthesia are mostly the same. But in local anesthesia, we only anesthetize a small part or isolated part of the our body. But in regional anesthesia, we anesthetize a larger portion or like a limb or below the chest. So the for targeting local anesthesia, we target only small amount of nerves. But while giving regional anesthesia, we target a main nerve or a group of nerves. So the portion of the anesthetized area is more in regional anesthesia as compared to local anesthesia.
Okay. So what ma'am is meaning to say is that any time a patient is undergoing a major surgery ranging from the shoulder up to say the elbow or the wrist, they generally prefer a regional anesthesia versus just a finger surgery or a smaller procedure, a soft tissue procedure that can be covered under a local anesthesia.
Yeah.
Ma'am, I think medicine has come a long way through these decades, and we see that robots or AI is being incorporated in various fields. How do you feel that your field has also progressed in the same sense?
See, initially when we started giving regional anesthesia, so it was given blindly, as in we just used to see the anatomical landmarks, palpate it, and give the drugs. So it was like just by judgment and palpating the anatomical landmarks, we used to give anesthesia. Then came the peripheral nerve stimulator. By that, we used to give small electrical impulses which could cause a sensation or a muscle twitch. So from there, we could properly localize the nerve and then give the anesthesia. So the precision was more as compared to the blind technique. Then come the we are currently using the ultrasound guided techniques. With ultrasound, we can see the nerve as well as in the surrounding area. So we can properly direct the needle to the required region or near the nerve, and we can deposit the drug to the near the nerve. So the precision and accuracy of the block is more when using ultrasound guided technique, because we are visualizing it and then giving the drug. Also, the dose of the drug has significantly reduced because now we don't require that much amount of dose as compared to the previous.
Right, ma'am.
Yeah.
And do you feel AI would have any applications in your specialty as well?
It might be with the see now ultrasound guided is like 2D technique. So maybe with further AI integrated ultrasound imaging, there might be 3D or 4D techniques, and so there will be more accurate visualization of the nerve or the area, and then we can give the drug, and maybe the outcome of this will be even better than the current whatever is going on.
Right, ma'am. So, ma'am, as precise as this technique is, it may occasionally so happen that the anesthesia does not act. So, in these patients, what is your next backup option?
Okay. So, see, usually in Pinnacle Hospital, we use ultrasound guided block. We give. So, there is very less than 1% chance that the block will not act. Okay. It might be that the block has acted partially, as in the patient may have some sensation, but there is no pain sensation. They might have touch sensation, or they might feel that something is going on, but they don't have pain. So in this case, we can add additional drug, and we can give it to the local area, so that effect is nullified. If not, if rare cases, if the block does not act at all, then we give general anesthesia for the patient. But even when we give general anesthesia, usually there is some action of the regional anesthesia. So the drug used for general anesthesia, the dose requirement is quite reduced. So we don't have to give much amount of drug for general anesthesia also. So the patient comes out of general anesthesia early, and also post-op pain relief is there.
Okay, ma'am. Ma'am, also a lot of times patients are often scared to undergo any sort of procedure because of the risks that anesthesia carries.
Okay.
So, what are the potential complications of giving anesthesia or blocks?
See, when you are giving ultrasound guided anesthesia, the complications are relatively reduced. Still, there might be systemic toxicity of the drugs. Any drug which we give, there might be toxicity. Not necessarily because you are giving additional drugs, but the different patients react to the drugs differently. So there might be systemic toxicity. Some patients, rare to rare, might have seizures or any cardiac complications. But we have, till my practice, I have not seen these complications. There might be allergic reactions. There might be bleeding at that site. There might be a nerve injury, which is also decreased because of ultrasound, because you can see the nerve. Then there might be hematoma, as in there is collection of blood, rare to rare, that can be there. So these are the main complications. Another one is the dose, the action of the drug is prolonged. So sometimes the patients are anxious that still my hand is numb, still there is weakness. So sometimes the action of the drug is prolonged, but after a certain hours, it does return to normal action.
Right. But I think all literature and review points that all of these complications may occur in, I think, barely less than 3% or 2% of the patients undergoing the procedure. So all in all, it is a relatively safe.
Quite safe anesthesia.
Right, ma'am. And one of the last questions that will, I'm sure, put a smile to the patients' faces. Can we discharge our patients on the same day that the procedure is performed?
Yeah, see, the action of regional anesthesia is limited to certain portion of the body. So otherwise the patient is well awake, we hardly give any sedation. So the patient can go home on the same day. But we have to give proper instructions to the patient. We have to tell them that the action of the anesthesia may last for 48 to 72 hours also. So you have to take care of your anesthetized limb because you will not have control on that limb. So there might be some injury or anything. So you have to take care of that limb. You should not lift any weight from that hand. And if any problems occurs, then you have to report to the doctor immediately. Otherwise, the patient can be safely discharged on the same day. There's no issue.
Right. Thank you so much for joining us today and addressing some common questions that our
Thank you.
patients have.
Thank you.